We're live. Kia ora te whānau. We are here tonight, with another Facebook Live. Tonight we are going to be talking about eczema and preventing food allergies. So my name is Makere. Some of you might have already seen me a few times on our Facebook Lives. I am one of the PlunketLine nurses. I've been at PlunketLine for 1 year now, and previous to that I worked in the community for 6 years as a tamariki nurse. Today we are joined by Dr. Rebekah Thompson, who's going to introduce herself.
Kia ora. Kia ora koutou. Thank you for having me. So as Makere said, I'm Rebekah, and I'm a general practitioner north of Auckland, but I also have a special interest in allergies and have gone on from my general practice training to do further training in allergic disease through the University of Western Sydney. So and I am fortunate enough to sit on the Paediatric Allergy Network of New Zealand, which is basically people in the background who are trying to help further people in New Zealand's understanding of allergies in children and how best to manage them and to prevent them. So that's where I sit, and it's a great privilege to be here to talk to you all tonight.
Oh, awesome. I'm actually really excited because PlunketLine, we get so many questions about eczema and how to prevent allergies and starting solids and all of that. So I'm just so excited to pick your brain and just take in all of the new information so I can help all our whānau. So I'll just go over a bit of an overview. So how we're going to work today, we're just going to go over some questions. So we'll be talking about my baby has eczema. Should I avoid giving them allergen foods? Why is it important to start giving allergen foods? First line treatment to control eczema, tips and tricks for dealing with both the physical and emotional strain eczema can cause for you and your pēpi. We know eczema can be really quite hard on a whānau, you know. It's something that it can, especially if it's uncontrolled, or you can feel a bit lost on where to go next. So this is going to be awesome. So these are just some of the questions. whānau, if you've got any questions, just chuck them up in the comments and we can kind of go through them and answer them as we go. Is there anything else that you can think of that we can talk about, that we'll talk about? We'll just kind of throw it off each other's.
Yeah, we'll see what comes up. But if we're still have time, then I'll chuck something in at the end.
Yeah, cool. So at the end of this, we'll go through, if we talk about any resources or anything like that, we'll just put them in the chat so you'll have them and they'll come up. How to find the links and that'll come up on the Facebook Live, and you can get those anytime. So I guess we'll start. So Rebekah, where did your interest in allergies begin?
Well, people often ask me if it was through my children, because one of my children has all of the allergies that you could possibly think of, actually. But surprisingly, no, it wasn't. I actually was working as a GP, and I'd often be confronted by these test results. You know, someone's asked their GP for a skin test, and then I work in quite a big practice, and so that they might not necessarily follow up with the same GP, and so then they might come and see me, and I'd be looking at these results going, well, what does it mean? What should this family be doing? And it was actually quite scary to think that I could be doing the wrong thing. So and then I heard about a very tragic story of a young woman in New Zealand who had lost her life to food allergy, and it was because it had been removed from her diet to help her eczema. And so when I learned about, you know, how this tragic story had evolved, I thought, gosh, I don't want to be someone who's not informed enough to make the right decisions for these parents and tamariki. And so then I went and did further training. I just went to everything I could. And then I decided in 2018 I bit the bullet and I did the course through the University of Western Sydney, and that was a very intense year. But I learnt a great deal, and so I've been able to provide that allergy expertise in my local community, which is really nice. I do that in general practice, but also have a private clinic, so that other people from other practices can access that information. And then I also have been travelling to Northland once a month to be able to provide the that expertise up there as well. So so it has come in handy for my son, though.
Cool. So when a whānau come to you, kind of what furthers on that next sign of like that treatment, or when does it become like that expertise for you? Like, what are the signs? What are you looking for that kind of referral for you?
Yeah, so I mean, there's a often a couple of ways that things come to my attention. Sometimes it's people have been looking for a test. They want to know what's driving the eczema. They really want to know, is this a food allergy? And so that's probably one of the most common presentations, people coming and asking for a test or tests. And then the other one is just completely inadvertently. So one of my most rewarding situations recently was a young girl who was probably around the age of 4 and had come in for something completely separate in general practice. And I had noticed there really, really severe eczema. Severe. I've not seen one like quite to that extent for a long time, and the family had sadly kind of given up on anything because nothing had worked, that they tried so fast. So I asked them to come back and see me again, and we went through it, and I just got to follow her up recently, and she slept almost through the night for the first time in 4 years, and it was just the most rewarding, wonderful thing to have been in that position to help her. So it really is such a rewarding role to help people who are desperate, and it is such a desperate condition, isn't it? Difficult to deal with this really itchy child who's often just not very happy. They're not kind of necessarily interacting the way some of the other children in the family are, and sometimes they're quite picky eaters as well, and that it can affect their appetite, so it becomes a bit of a vicious cycle.
I feel that working in the community for as long as I did, you come across some whānau that are just at that stage too. So that's amazing. That's awesome. So what was your kind of plan, and what was your advice? Like, was it advice around foods to avoid, or was it the skincare routine? Kind of what was your
interestingly enough, they were interested to understand if there was some food that they should be avoiding, but that had actually, like many parents that I have that I come across, they had already tried some food elimination and hadn't been finding that it was working that well. And this is a really good way to introduce a concept, because of it not really being related to foods, actually, because it's almost all of the eczema is a problem around the structure of skin. And so we know that it's actually a change in the DNA. We've known that for about nearly 2 decades now, people who've studied allergy. But it's very natural and common that people will be looking at foods and they're desperate to find things that will help. And I get it, I really do. But it's really nice actually to give the information about what is actually underlying eczema. It's this problem in the skin. So instead of having really tightly constructed skin, so it should be like Glad wrap or like building blocks that have got mortar in between, there's nothing getting in or out. So unfortunately, once those building blocks are not quite so tightly close together, then all the problems start happening because of that. And so if we focus on trying to help those building blocks of the skin with a really good skincare regime, like I was able to give this family, then we actually start seeing results. And what I often find is that they'll have one piece of the puzzle. They'll have like, I need to moisturize, or they might have I need to use this anti-inflammatory cream, or which is my my name for the mild steroid creams, because people get scared of them, but they're not actually scary, the mild ones. So, well, when you know all the information, they're not. So basically, they've got one bit of the picture and they've only been given one
Yeah.
bit. And if you can pull it all together, it's just so wonderful to see it starting to work. Within a week, we see it working. It's just a marvelous thing. So they need the full. They need the full plan. They need the whole lot of the picture, and some of that is some of those resources are available online. And I know that Plunket have done some wonderful eczema webinars as well, like this one, Facebook Live sessions, and there is some available stuff online for free from some eczema experts like Dana Purvis in New Zealand. So there's lots of stuff there, but it's just knowing where to find it. And I think we're going to be linking some of that in at the end. So if we work on the skin, everything starts falling into place, and then we don't need to look at the foods, because actually one of the things we want to talk about tonight, I hope, is that we could actually do some more harm by looking at food. So hopefully we can get to that point as well. Yeah.
That's a good tip, because I guess that's where our mind goes to automatically is it because of the food? Is it, is it reacting to something, or is it insensitivity or an intolerance or something that's making it? But that makes sense. It's the integrity of the skin. I remember talking to, I think she was a nurse practitioner specialist, and she said that it was like areas of the skin being very porous, so like the mesh bags of the mandarins. And I found that really useful, and it's those areas where the moisture's just not holding it. It's just coming, because there's nothing to hold it there, and it's just coming through. And I used to say to whānau, make your baby like a white ghost at night time. And I used to say at night time, because nighttime is the best time, because they're not going to be touching themselves and rubbing it in and moving around. So when you go to sleep, make them as white as a ghost as you can in those areas where that skin's really dry, because that moisturizer is going to stick in there, and it's not going to be
so it's good. So sadly, children with eczema, they have shown that there's like 3 main reasons why they're so itchy. So and that's like extra reasons on top of why another child might be a little bit itchy if they get a rash for some other reason. A child who suffers from eczema is even more itchy, so it's really unfair. They have more itch receptors in their skin, they have more bacterial load because they live in those porous gaps. They have moisture escaping, which makes us itchy. So it's like it's fighting a moisture loss battle and an itch battle, and if we can get on top of the itch really well, then they just have so much better quality of life. It's such a debilitating condition otherwise. So better sleep, concentrating at school if they're at school, and that kind of thing.
So what would your advice be to a whānau that have got like kind of the mild eczema, to kind of get there beforehand, before it gets to that medium or that real severe? What would you say if a whānau came up to you and said there's patches of eczema? So I often find just the level of acceptance of like itchy skin or rough skin or mildly pink skin is like, oh, that's better than it was, that's okay, we can leave it alone now. But actually the aim is, and this is always my aim, is that they have smooth, completely non-itchy skin. That's what we're aiming for. And those low-level steroid creams, the mild ones, are they're really safe to use. They've shown that they can't actually get through the skin, so they can't cause thin skin or cause harm. And so actually keeping on with those longer than you might expect, till the skin is smooth, like just really clear. And that way you're not going to flare all the time, because unfortunately there's things that are outside of our control. The weather, sadly,
getting a virus,
Mm-hmm.
or lots of reasons why the baby's eczema flares. And so just keeping on it, like really keeping on it, keeping vigilant. So I sort of think of it like, yeah, it's a real lot of work putting these creams on all the time. You're sort of it's tough, especially I remember when my son was running away from the creams and I was just like, come back, put this on you, with his eczema. And I kind of think, we're trying to think of the long-term game here. So if we can get on top of it early, they're much less likely to go on and get things like other allergic conditions. So.
Yeah, because I think that is a common thing that comes across as parents are real hesitant to use steroid creams or especially long term. So that's good to know.
Yeah, there are some really, really good long-term data, and so basically, in other words, all the experts around the world for children's skin agree those low levels are not harmful. So it's really like I don't know if people know this, but this always boggles my mind. And when I say it to patients, they're just like, "Wow, did you know that the top level of cream is 600 times stronger than the bottom level of cream?" That's ridiculous. They're not even in the same ballpark, right? Yeah, 600 times. So we can't compare, and unfortunately, that's what you often get some differences of opinion, and I find this is really tough for parents. But the pharmacist or the GP, and don't get me wrong, I'm not knocking them because I am one. It's just when you've done the training and you know the difference in strength, then you feel comfortable to say, actually, you can go to town with that low level one. They could swim in it, they could bath in it. It actually wouldn't do them any harm because it's so pathetically mild. So there you go.
So what would that percentage be? Like, what's the low level if parents are looking at it going, oh, is mine a low level one?
Yeah, so there's the 3 low levels are fine. So I'll go on colours actually as well, because I know a lot of people just look at the colours, and that's fine. So your lowest level is white with kind of aqua. That tube is the hydrocortisone 1%. That's safe for many, many years of use, anywhere on the body. In fact, even on the eyelids, it's fine. And then level 2 is the gold tube, and that's really safe as well. Actually really, really safe. But sometimes you need to go up in level because things aren't getting better. So you're like, and then the level 3 is still safe, but just on the body. So that's the either a yellow tube if you've got locoid, or white and pinky tube. So basically those are the 3 levels that I never have to go stronger, really. It's like if you're doing all the different elements, then you'll get somewhere. So yeah.
Can we just confirm that again? Because I know that this is going to come up again.
That's so all right. The lowest is I actually label them for patients. But the lowest level is level 1. And in fact, actually on the Starship website, there is a list. It's a link to for whānau to look at. Under the Eczema Network page. So there's a link, and it lists the lower level ones and what their potencies are and stuff. And it's actually a link to an Australian dermatology site for kids. And then there's the next one up. So that one was white with aqua kind of colour writing, and then that's level 1. And level 2 is the gold tube, and they're safe everywhere. And then the level 3 is just on the body, and that's either yellow or it's a white tube with pink writing. Yeah.
Beautiful. Cool.
And so those are really safe for quite a long time. Like I know a lot of people are told just a week and get off them. It's actually not true. So go to town.
Just for like my own kind of thing, what would the 600% one be?
It's called Dermal, and I did find an adult who'd been prescribed it, and I was like, on the face even, and I was just like, oh no, someone's got confused here. Surprisingly, no thin skin. So really, really hard to thin the skin, by the way, people. So, but that was not what she should have been using. So that's luckily not in that happen.
I know another thing that we came across quite a bit in the community and with care plans and that with eczema was the use of bleach baths. Is that still what how do you feel about that, and what's the advice around a bleach bath?
I know that people were scared by the word bleach. Sounds very scary. But actually, again, on the Starship website, there's a link for whānau, and it's just got like an actual amount that's that you can know exactly how much to use so that you feel comfortable, and that is it's considered 100% safe. It wouldn't actually matter if they splashed it in their eyes or drank a little bit or whatever, because it's too small amount. What is the aim of it, I think, is really important, and that's we're trying to make sure that the bacteria doesn't keep getting out of control. So I think this is particularly useful for children who have had a course of antibiotics, and then they start a couple of nights a week having a bleach bath. So one of the things that I think is just so fascinating is that when they did some swabs of children's skin and compared kids who'd had eczema in the past but no longer had it, and kids who had no history of eczema ever, there was 8 times more bacteria on the skin of the children who didn't even have eczema still, but they had a history of it. So what does that mean? It means that those gaps keep the bacteria even when they're not even looking like they've got eczema anymore. So we have to wash that bacteria off every day. Daily wash is important, and not using sodium lauryl sulfate, aka soap. So if something says soap free, I just check the back for that, and I can put that name at the end. I can put that up if people want to know it, because I do find sometimes there's a bit of variation on what is apparently soap free. But avoiding soap is really important, and then washing daily gets the bacteria off. But for the kids that keep getting infected, those bleach baths are life changing. Nobody wants your children on recurrent antibiotics. It's not the ideal.
I've been to the Starship website, and they also have the brands and exact measurements, and it's a really awesome resource, and you can actually have it in the color, so it's got all the colors, all the labels, exactly where you could buy it from.
Yes, awesome. Perfect. You're so right, really Makere. Cool, it's amazing. Really good resource. So I feel like it's a prescription. Here you go. Here's your prescription. And I think maybe if someone's really confused about my percentages and stuff of steroid, probably the best thing is to go and have a look at that link on the Starship website. So again, it's just under Eczema Network.
We might be able to put that link on the Facebook page as well, like we can with the other ones. And so I guess have the percentages and the names and all of that.
So we're just looking at the bottom 3 kind of levels. I didn't expect I would talk so much about eczema, but I guess I think just going back to what usually people are looking for testing, and I just think we maybe should touch on why don't we test, because I'm only given half the story otherwise. So basically, if the tests are done, they're not 100% accurate. So that's skin or blood tests for allergies, and actually eczema, it's not that part of the immune system anyway, so it's really not that useful. But unfortunately, it can throw up these false positives, and then what do? You've got this milk when you've got this, this egg, and you're like, well, does that mean I need to stop it? And unfortunately, it's really hard to ignore a positive test, really. But it is just that, it's often just a false positive. And in a child who has eczema, it can be 50% of those test results could be a false positive. So it's quite high, even more than kids with non-eczema skin. So it's anything up to 50% false positive rate. So why is that? Well, their skin's really sensitive. So if you put something on there, that skin test can be really likely positive. And then the blood tests are really quite difficult to interpret. They don't have a very good cutoff. So anyway, the moral of the story is we're best to test when there's a really good going symptom that seems like the right kind of food allergy. So we're looking for quick onset hives or vomiting or breathing difficulty or something like that, and those are really likely to be that part of the immune system, and so that's why we would test those. Whereas eczema is actually a really chronic inflammation type part of the immune system. It's not even the same sort of thing. So we don't want to throw up a whole lot of false positives, and then this child, they get things removed from the diet, and unfortunately that can make them more likely to be allergic to that food. So we could be causing a problem in the long term. So some of those, as a lot of you might know, some of those food allergies don't go away.
Yeah.
So it would be better to keep them eating it because they're not allergic to it. And fortunately, our stomach has, especially at that young age, it has this special ability to tolerate foods. But if we take the food away, it doesn't have that anymore. So we've got to keep giving it to the stomach to keep that ability going. So it's a real critical time of life that they're under 4. It's really important that the foods are going in, meeting that part of the immune system, and we're learning to keep eating stuff and being able to tolerate it. So yeah.
So for a whānau in the community and their child is having kind of allergies and that, so when would be the best time for them to kind of go to see the doctor? Because you've got the doctor and then you've got all the health kind of specialist and skin testing or hair samples and stuff like that. What would you recommend for a whānau that have got?
Yeah, I definitely think go and see your GP as a first port of call.
GP,
Different parts of New Zealand have different access to testing, which is quite sad. Not equitable, unfortunately. But first port of call is definitely your GP. If they don't know, sometimes they can write to one of the allergy specialists and just ask for advice. That can be quite a useful avenue to get expertise, because a lot of people might know that the wait list can be quite long. But I would say I would really recommend that you don't get hair or saliva testing. They've not got any evidence to actually have any, they're not useful basically. So they're not testing the right part of the immune system. So only a skin or a blood test can test that part of the immune system. We don't actually have IgE antibodies in our hair or our saliva. So that's a big waste of your money, I'm afraid.
Cool.
So yeah.
Yep. We've heard it there, whānau.
Yeah. Spend your money elsewhere. It's much not worth it. Yeah. And again, like if we're casting a broad net, we're gonna pick up a lot of different range of results. So, spread actually the field of allergy, we're all about narrowing it down. So that's one of the things I do in my special allergy clinic, is I spend a long time really narrowing it down with all the information I need. So it's quite important.
Yeah. So if a whānau have a history, like mama has an allergy to something or one of those high allergen foods, how would they go about introducing that food to their baby, and what would that look like?
Oh, that's such a great question. Thank you, Makere. It's very common that people are really worried about the food that they're allergic to or their child is allergic to, and also like worried about handling it. And I've seen some really creative situations. So, for instance, a mum had a peanut allergy. The grandparents of the child were feeding the peanut to the child when they went over there, a couple of times a week, which is really great. So we're kind of hoping to get those allergens in a couple of times a week is about on average. So if it's not you, it might be another family member if you've got the allergy. But it's extraordinarily rare that you would have any trouble breathing the allergen in. So that can be in the environment. I think the other situation that is quite tricky for whānau is when the sibling, either younger or older, has a food allergy, and you're trying to feed the other sibling and not contaminating everything. So again, it needs a little bit of special care, but it is still possible. Or you could perhaps feed outside of the house or at a different time of the day when so at someone else's house. Different time of the day when that sibling's not around, etc. But it is extraordinarily uncommon that they're going to have exactly the same food allergy. So basically, the allergic tendency, that ability to have an allergy, is inherited, but not exactly the same allergy. So if a parent has a peanut allergy, that child might have a tendency to have an allergy, but they're not necessarily going to get the same one. So You don't
Okay.
have to be fearful that they're going to react to
Yeah.
their first
Yeah.
exposure to peanut or to egg.
Yeah.
And so there are some good tips actually around those two very common allergens, the peanut and egg, because we really want children with eczema to get those in early, like around about 8 months old. And
Okay.
so the peanut, we just suggest, and this is sort of an Australasian wide recommendation now, and our guidelines in New Zealand have changed as well, thankfully, in about
Yeah.
2021.
Yeah.
But yeah, so basically this is backed up by all the governing people now. So yeah, I'm not just speaking out of turn, but basically, if you get a little bit of the peanut paste or butter, which is smooth peanut butter, and
Yeah.
if you're just touching a little bit on the inside of the mouth. Now, we don't want to rub it on the skin. The skin's very reactive
Sensitive.
at that age.
Yeah.
It's going to come up with a rash for sure, but it doesn't mean they're going to react to it. It's just sensitive skin. So inside the mouth, and then wait for 10 minutes. And if nothing happens, they're not allergic. It's great. It's very. But also, I think the really important information for parents is that if they do have a reaction, it's usually very, very mild. And even if it's not that mild, they don't, at that age, they're really equipped to deal with it.
Yeah.
There's a phenomenon where it doesn't, like older children, more likely to have severe reaction, whereas younger children, really likely to get through it very easily. So, and then you go and see your either urgent care or after hours medical, if just for the next step. But to be honest, most of them, the symptoms have gone by the time they get to us, because it's usually so well dealt with by this young child. So yeah, it's a commonly scary thing, but it actually doesn't, it doesn't end up being a scary problem. So
Yeah.
yeah.
So is it? Yeah, it sounds like maybe. Yeah, like it makes a bit more sense now when we're telling parents, we're introducing these allergens earlier now more than what we used to. And is that why now? Because we know that if they're older and they haven't been exposed to
Yes,
it, they're
yes.
responding worse. And if they're
Yeah, much more likely to have a severe reaction if they're older and
yeah,
not had it that whole time, but also because that gut that I was talking about
yeah,
and that special immune response, it's really designed to accept foods rather than reject them,
yeah,
and that doesn't last forever. We know for some allergens it's particularly under a year, and so that's why the common statement now is try and get all the high allergy foods in by 1 year old, but particularly peanut and egg we think might be by about 8 months if you've got eczema, so or a family history of food allergy. So that's why we're really in the allergy net, we really want to get that information out there. Unfortunately, Plunket, people are putting these information out there for parents as well, so it's good.
yeah. What about the non-like skin reactions and the vomiting and the tummy constipation or diarrhea symptoms? What kind of advice would you give
So,
around that if babies have it reacting to foods that way?
so it's actually pretty uncommon in the under ones to
Mm-hmm.
be reacting to some of these, the peanut or the egg in that way. Pretty
Yeah.
uncommon. I think a lot of people are worried about, like when they introduce formula or cow's milk, that might be causing constipation or diarrhea. And sometimes you will definitely come across children who've got like a bit of intolerance to that, and they might get a bit of, but it's probably less common than we think actually. And I think the useful thing to do in that situation is just to reduce how much you give and what type you give, so that
Yeah.
they're still getting it and they're not going to become allergic to it in the severe allergy way, but they're not having too many symptoms. So for instance, you can put the milk in baking and then they're not going to have diarrhea to it. You can do a thin pikelet, for instance, and again, they won't, with milk in it, and they won't have diarrhea or constipation to that. So they're still getting some exposure, but they're not actually having their intolerance symptoms. So that way you can try and prevent them to have ongoing, more life-threatening allergies, which is, a real quality of life, a real burden
Yeah.
for the long term if you've got a long-term allergy. So, yeah.
Yeah. I think we've got a couple of questions coming up. I hope one of those questions we kind of just answered. Has it reacted to dairy, soy, and eggs, but can now have soy in food and eggs and baking? I think that's kind of, yeah.
Yeah, I think as they get a little bit older, they can have more intolerances. But again, I would just suggest that you can expose them a little bit, and often in baking, if they're having it just a couple of times a week, they're still getting exposed, but they're not necessarily having intolerance type of symptoms. But yeah, as certainly in that under 1 age group, those are very unlikely to cause problems, those foods. So, yeah.
So as they get older, what age would you say for a child who has had a bit of an egg intolerance or a dairy intolerance or soy, what age would you be able to say, oh, okay, we can fully... Does that depend on the amount that you've given them as they were younger to build up that tolerance, or is there an age where you can say...
Yeah, I mean, I think you can just gradually try and increase. But I think if you've withheld something for a long time, like 100%, then you need to seek advice before you start giving it. Because if they're like 3 and they've never had something before, that might be likely that they have that they now have a problem. Whereas if you've been giving them little bits now and then, and maybe they've just had sort of like a teaspoon of yogurt once a week or something, it's less likely they're going to be allergic to that. And so you can just gradually build it up to see how the symptoms go. And I've come across a lot of parents that have been successful at that. I think you guys are smart. I really do. I think people are amazing. They've sorted all sorts of things out, and I'm like, wow, that was really good.
Cool. I think we've got a couple of other questions here. Shannon, are skin prick tests accurate in identifying food allergies? I think we touched on that a little bit before, but...
Yeah, so I mean, I think unfortunately a lot of places have really long wait lists for food challenge. So if you've had a positive skin test and the child has never eaten it, I'm not at all suggesting that they should go and have that food. You really need to seek expert advice in that case. And each situation is individual, but I know that in my area, unfortunately, the wait list for a food challenge, which is the next step if you've had a positive test and not eaten it before, and particularly if you're over 1, then you would probably need a food challenge, so you'll have to get a referral for that. But some places are really long.
Would that normally be processed through, like, say they went to the GP would then do the referral and then,
yes,
and then it'll kind of follow on and be part of the care plan from there?
Yes, yeah.
So the first port would be for whānau to go to their GP and discuss the allergies with the GP. Is that...
Yeah, and get the referral. So
cool.
Cool.
Brooke, have a reflux baby who has been power chucking when I eat egg. How would I go about introducing it?
So with egg, the really well cooked egg is the way that we'd first introduce it. But I think if the baby, if you're giving them a little bit of really like hard boiled egg mashed up with maybe some breast milk or something, you're giving them a little bit and they power chip straight away, you need to go and see your GP about that one for consideration of what's going to happen next. But if they're just doing it in the milk, it's actually very unlikely to be a true allergy at that stage, Brooke. So I would still try giving them the hard-boiled egg mashed up first, and then if they have a response to that, then you're in a different situation.
Sarah, my toddler is allergic to peanuts and cashew nuts. The pediatrician only tested for these 2 nuts, told us to avoid all nuts and won't see us again. Why might they not be testing for nuts?
I think different areas, it's really hard, isn't it? Because ideally, we should be testing for all the nuts before we say they can't eat them. My approach is more modern. I like to get kids eating the other tree nuts that they're not allergic to, and I think that tends to be the practice of the wonderful allergy specialists that I've been fortunate enough to be around, so, and have helped train me. So I think there are some important quality of life considerations in that. So for instance, you know, let's say you've got an allergy to a rare nut, like a walnut or rarer nut, but you know, not being able to eat other nuts, that can be quite debilitating. So it means you can't eat at certain restaurants because they're likely to have contamination. So one of my favorite things to do is actually to liberate the diet for different things. It's just such a wonderful thing. Like I had a 15-year-old boy who had been advised that similar sort of situation when they were younger, and I think it was more common practice, I think, a few decades ago, but he was just so excited when he learned he could have his first ever scorched almond. He was a very happy young man. So yeah, but you have to test it first. Sorry, is the answer. You do have to have a test. So if you've got no access to that, that is really a shame. Sorry.
I think that's the thing for, you know, a lot of people would be, where do they go and how do they advocate for that in areas where they might not have the same resources that other people have, that equity of care.
Yeah, I mean, I think it's a real problem. We identified in the Allergy Network the disparity amongst different regions and what you have access to. It's really a shame, a big shame. And I think, as always, we need to find ways to get that information back to people who can make a decision differently. So, for instance, policy makers, and so your local MP might be a good place to start. And the squeaky wheel gets, what's the saying? The squeaky wheel gets, I don't know what the saying is, but you know, if you make more noise, make enough noise, hopefully we'll start getting some
people
traction.
start
but
listening.
it is definitely something we have identified on the Allergy Network as a problem, and we would love to address it. We really would. It should be equitable access across New Zealand, across the motu.
Yeah, definitely. Cool. We've got some more eczema questions coming up, but I just want to kind of keep the focus on the allergen foods at the moment, because just while we're just talking about it.
Yeah, and that there, just so if people are disappointed, there are some really good Facebook live chats about eczema out there, Makere, that Plunket have done. So you can go and have a look at those, can't you? You can just find them on the Facebook site, and you can,
Yeah, definitely. We've got heaps of Facebook lives on there in the past for eczema. We talked about it earlier, the Starship resources. I think we're going to put a link up. They have some really awesome things about, like we talked about the bleach baths, the hydrocortisone creams. I think there's also a really cool resource on there about mild eczema and what, you know, is it the jeepers, what's the cream that's most used?
Acetylmacrogol and glycerol, the white pump bottle with the pink and purple sorbeline. Yeah, they actually, it's not the same.
Still funded?
No. So yeah, it's just a big white bottle with the pink and purple on it. It's got a funny name on it, but you know, so people will recognise that bottle. They'll understand.
Yeah, and then you've got the big aqueous, like, keep that in
big tub. Yeah, the big acetylmacrogol.
Try and ask for like more than the normal amount that you might get prescribed, because you will live with that. That will be your Yeah.
And I also, little extra tip is, if you're putting fingers in there, you're putting bacteria in the tub. So it's better to use a spoon to get it out. And even if you can find a little plastic spoon and just leave it in there, even better. So so I think, and another little tip, just while I'm there, because these are commonly asked things that I experience every day, is moisturizer first or steroid first. Well, steroid actually needs to go on first, because it needs to treat the inflammation. Then you whack well, not whack, you actually place the moisturizer on afterwards. And I think I did see a question about someone saying, doesn't washing every day dry the skin out? Well, actually, the moisturizer on after the washing is going to counteract that, so you don't have to worry about drying the skin out by washing every day. What we're really trying to achieve is get the bacteria off, because the load of bacteria is huge, 8 to 10 times more on your eczema child. So that idea of washing less often actually came from a study in babies who didn't have eczema. So it's not relevant to eczema children, it's relevant to children without eczema. That's fine. You can do that. You can bath them once a week if you want. That's absolutely fine. It doesn't do them any harm to be bathed less. But the eczema child is a different scenario. So,
So did you say steroid cream first and then the moisturizer?
Yes. Well, you think about it. I've got a lovely diagram which I should have probably had here. I'll just flick it up. If you think about it, all those layers of skin, like you think of it, like, you know, it's quite deep, some of the information. And if you put the moisturizer on first, that's like our barrier layer. It's plugging up all those gaps. That wonderful analogy you have of the mandarin. What did you call it? The netting around the mandarin. They've got all those holes. The moisturizer is there to plug it up. So if you put the moisturizer on first, the steroid cream can't get through that. So that's why.
That makes total sense. But you wouldn't.
So I think this is a wonderful opportunity to talk about those little tips, because unfortunately they're often easier to give in person, aren't they? So
definitely. And then kind of knowing and understanding why, I think helps. I think that's helped me a lot with everything I do.
Exactly.
You know, understanding the why, because then it makes sense.
So
was there anything that you wanted to add with the allergen foods? And like, I've had a few phone calls about parents that would try, and when they would give an allergen food, they would sit outside a hospital.
Park at the hospital. Oh gosh. I get asked this a lot, actually. What should I try not to? As a doctor who actually also works in urgent care, so that's an after-hours facility, I can tell you very clearly it is so hard to treat anybody in a car park or in the foyer, or in, you know. So, in other words, that's like probably the hardest place to actually give treatment to a child that's having an allergic reaction. You're much better at home, because the ambulance, if your child had a severe reaction, which again they're not actually probably going to have if it's their first time trying it, or they're under one stage, very, very uncommon. But let's say that they're at home, that you get the services straight to you, or when you come to the after-hours facility, let's say they've got a rash and you're worried about them, that's fine. Come to the after-hours facility or the urgent doctors, and or the A&E, wherever you happen to be, and we can help them better inside. So outside is really hard. You haven't got all your equipment. It's really like probably the worst place I would want to be treating a child with allergy. But at the same time, sometimes it happens and you were driving somewhere, that's fine. But it's just like, I wouldn't plan to do it in the car park, that's for sure.
And so I'm thinking most would probably be doing it just in case they had a severe reaction, they could run in really quickly. But I guess you'd be very, if it was
it's actually I think that the whole understanding of whether this is likely to happen is probably the main point I should make. Is just that when you're first trying a food, they're not going to have a severe reaction. The kids who have severe reactions, all the data shows us they're older. They've got known allergy. They might not have known that they had a severe allergy. They might have had a mild reaction when they were little, like under 4. It's when they're 8 to 15 and they're out, at a cafe, and there's something they didn't realise was in the food, or the 15 and older and they're out with their mates. That's the time when those severe allergies happen, because their immune system has become much more sensitive to it over time. And it's not your under 4s, it's not your little kids that we're talking about tonight. It's not on your first exposures, it's not even on your second or third exposures if they're really young and you didn't quite recognise it in the first couple of times. And I just can't emphasize enough, they're so well equipped to deal with new foods. It's phenomenal, really. We're quite well designed in that way. And I think, unfortunately, in the history, we've kind of interfered and we've said, oh, you shouldn't have this till you're 1 and you shouldn't have that till you're 3 and all these other stuff. And actually, if we kind of just let them eat whatever, we wouldn't have this fear, and we wouldn't actually have so many food allergies. It's not the whole reason, but it is contributing to delay the food. So
I love that. That's awesome reassurance. I think that'll help a lot in practice and kind of giving advice out to whānau, because it's a real fear for whānau out there that
it is. Because
I guess you don't know what you don't know.
Yeah, that's right. And I mean, I think I think the data, the statistics, they speak for themselves, which I'm privileged to know. And I just think, oh yeah, you're so safe when they're little. So good.
Yeah. Was there anything else that you can think of that we might have missed? Just on that topic, we've got a few things. I can see some questions coming up the side, but anything kind of on that lines or anything you wanted to add, and then we can ask some questions.
Nothing came to mind. Oh, just a little tip about trying a new food if your baby has got eczema. As we said, their skin is so sensitive. We get these really confusing rashes, right? They're like, oh, it's gone a bit red. Is that an allergic reaction? Is that just, oh, what's going on here? So actually you can try and avoid that altogether. They're just putting some really thick moisturizer cream around their mouth. I know that sounds terrible, but they don't know any better. So just like a barrier cream, preferably not the ones with nut oils in them, please, but pseudo cream, for instance, the emulsifying ointment you can get from the on prescription from the GP. So some of these barrier creams, unfortunately, they do have nut oils, so we don't want those ones, but barrier cream around the mouth, then you don't have the confusion of, is this just the stuff touching their very sensitive skin? That's an easy one.
That's cool. Yeah, that's a good one. Yeah.
And in case anyone missed it, just in case anyone missed it, don't try it on the skin first. Again, very sensitive skin.
I think that might have been one of the questions too.
Yeah.
I think, what was I going to ask? That was the thing with moisturizers too, because a lot of the eczema, I know that Avena does like an oatmeal moisturizer.
Fantastic. I'm so pleased you brought that up, because this is
almond oils
an area
and
of
stuff like
passion
that.
for me. It's a real passion for me. Yeah, please don't put foods on the skin, especially if they've got eczema. So baby skin in general is more porous, like it just, even children without eczema. But when you've got eczema, you've got these bigger gaps. And if you keep exposing the really good immune system that's under the skin, of course, we have to have a good immune system under the skin. We get a scrape, we get a cut, we have to fight off bacteria. We've got this excellent immune system under the skin, but it's not designed to make foods regularly. So there have been a couple of incidents in Australia where people have become allergic because they were putting like oatmeal or coconut oil regularly on the skin. That was eczema skin. So we're really keen. It's actually part of the Australasian guidelines now. In your creams, don't put foods on them. So I really encourage people to label read, actually. Turn it over, have a look. There's a lot of stuff's got sunflower oil in it now, and actually you can have sunflower seed allergy. So it's just best to avoid foods on the skin, especially if your child's got eczema. That's a really good question. Thank you, Makere.
Yeah. So you got there's the Aveeno child range with the oatmeal. I think there's even oils there with almond oil in it.
Yes. So unfortunately, like the panthen ointment, which used to be one of my favorites, has got almond oil in it, and even the zinc and castor oil that is prescribed, unfortunately, that has peanut oil in it, which is a real disaster, I think, because that's the one available. I just use the emulsifying ointment if I'm prescribing a cream, for a barrier cream for a baby or a child. And there's actually I have no shares in QV, but unfortunately, I wish I had, because they are actually one of the only brands now that don't have foods in their products. Like everything else has succumbed to the food problem. Even
they do that real good oil too, don't they? The QV. What's the
They
QV
do
oil that
everything now.
do?
They even do shampoo
Yeah.
and conditioner, which I'm
Oh,
very
there's a
happy about.
question here about shampoo and that too, I think.
Yes, and yes, if you don't have access to a Chemist Warehouse, I feel for you. But
You can buy
there
online
might
from.
be some stuff online. Yeah, so the QV
Mm,
shampoo and conditioner is a good option. I actually for a long time with my boy with eczema, I just used the Dermasoft, which is like a bubbly soap. It's got no soap in it, but it's an alternative. Just use that in his hair.
yeah.
Obviously, if you've got someone who wants nice, shiny, silky hair, you might use the QV range, and that's fine as well. Yeah.
Yeah. Cool. Yeah, I think. Oh, yeah. Thoughts on oatmeal soap baths. We've got a few of those there.
Yeah. So I think someone's actually asked, are there good natural options? I think we have to be really careful of that word because a lot of people are suckered into buying these really expensive creams online, and they are, the intention, I'm sure, is that they are providing a natural plant in them or organic product. But unfortunately, as I said, you've got this really good immune system in those gaps, and if you regularly expose your immune system to something through the skin, we do know there's a higher chance of allergy. That's been quite well demonstrated now. So I think if rather than going for natural, going for the ones that are really trusted brands that don't have food products and you're not regularly exposing to I know there's a few on the market like peony, and I don't have anything against some of the natural plants in general, like they're really good. But if you've got really broken skin, it's not the time to be putting them directly on there. Wait till it's nice and clear again. Yeah.
Because I think like Leader is doing a eczema range and all that sort of stuff, but that's also you've got to read the products or the
Yes.
the
Yeah.
ingredients, don't you? Because they've also got probably a lot of
They've got usually have calendula. I'm not
yeah
entirely sure how allergenic that is, but I just sort of have a bit of a rule of thumb trying to avoid all those things. But they do have sunflower oil because I check the product ingredients regularly as part of my job. Yeah. So and sometimes they're a little bit sneaky. Not that they intend to be, but you have to be a little bit like Googling because have to be a little bit more detective like because they might use the Latin word. So they're probably not intentionally being sneaky, but it's just you have to do a little bit extra work to figure out what is that thing.
I think that was one of the questions we had one time with the Weleda teething powder. It had one of the active ingredients is shells. Oh no,
Oh,
it was broken down shells, I think.
wow. Because that could have like some seafood shells or
Yeah, I think
yeah.
so. I can't remember. A
Gosh.
parent brought it up in one of our chats, and we were all like,
Yeah, that's not
Um,
so yeah. Yeah, I think anything that, raises questions like, is this a food product? Not a good idea. Yeah. So when they're older, we hope that they can enjoy whatever they want on their skin. It's often the cases that the skin gets less porous over time, so they just start getting less eczema, which is awesome. So if you do all the hard mahi when they're younger,
yeah,
they can often have just a completely fine time of it when they're older, and they can choose whatever they want on their skin, which is nice. I think that's a good outcome, really, to preserve that quality of life when they're older and they care more about what's going on their skin.
yeah, yeah, cool. I don't know if we actually covered everything that we were supposed to, but I think we've got had a really awesome kōrero here.
Yes.
I can actually
a lot of questions.
probably pick your brain for hours and hours. As I said, I'm so excited. But I think the
It's
main
wonderful.
things to take away would be, oh, you far away, yeah. What would be the main things to kind of for whānau to look out for, and what's your kind of closing
Thank
advice
you.
or?
So yeah, the main things are that eczema is not driven by food, so we don't have to twist
Beautiful.
ourselves in knots trying to figure it out. Just focus on the skin and the structural problem they've got, and putting all those essential steps together, which again you can find on the eczema network page on the Starship website. So put all those steps together and then it starts working. One step by itself doesn't start working, but put them all together, it starts working. Don't worry about the foods, but also do try and feed them stuff early on, and particularly where we've got an idea of trying to get all the allergenic, the common ones, in by about 1. So, and then the final thing is just you don't need to test first. Just got to give it to them, because we actually can't tell from the test whether they're going to have a reaction or not. So it's best not to sit on that long wait list for a food challenge and miss the boat, because that could be the opportunity you had and it's gone again.
Yeah, awesome. And also remember, whānau, PlunketLine's out there. You might get to have a kōrero with me. Our phone number will come across the bottom there. We're 24/7. So call us anytime, and hopefully we can kind of support you on anything like this. And hopefully you might get me. And after all of this new knowledge I have, I might be able to say, hey, everyone needs to move up north.
Or I might come to you one day.
Yes, come down here. It'll be amazing. All right. Well, I think we have been on for about our hours up now. So thank you so much.
Thanks for having me.
Yeah, it's been awesome. I could talk about this all the time. And I just think, this is awesome. And I hope everybody has got some of the answers. And check it out. We've got heaps of other information. All of those resources and that will be on the website. So
lovely.
Cool. Ka kite, everybody.
Ka kite.
Thank you.
Bye.